What you're about to see is not a day in the life of. It's not even a whole shift. It's a 30-minute slice of a regular workday for an ER nurse at the University of Kansas Health System. The ER is their office. It's where this team makes more high-stakes decisions under intense pressure than many of us will make in a lifetime.
Did this patient lose consciousness when she was choked?
From the minute ER nurse Tiffany Clark begins her day, she is faced with critical decision.
Nick, 15, might be having a seizure if you'll go check on that.
After critical decision.
Was her fall witnessed?
For the nursing supervisor at the University of Kansas Health System, this
I can do that part.
is her normal.
It's a lot of moving and grooving and being really creative.
And amid the backdrop of the pandemic, her creativity, flexibility, and level-headedness
Stacy, we're gonna need a room for this one for sure. This was an assault victim.
is key to balancing all the emergency trauma cases they would normally get on top of all the COVID patients coming through their doors, while also serving a large homeless population that does not have access to primary care.
Those patients are still coming in. They're not slowing down, but we just have all the COVID patients on top of that. It's affecting the entire hospital. And so I think we're all feeling the pressure.
Finding space is a constant challenge, and these ER nurses have to be strategic.
So Stacy, I think it's about time we probably open up a few hall beds just so the waiting room doesn't get too crowded. We're up to 10. I think
Start pushing people back here.
we could do that too.
52-year-old female who was found in the parking garage after a fall.
Clark is also acutely aware of the emotional well-being of the rest of the staff.
Thank you very much for coming to triage. Oh yeah. I appreciate you. Since you were in triage quite a bit yesterday, I'm going to give you a break from triage.
Nurses on the front lines every single day, saving lives at every turn, and at the end of the day, nothing is left on the field.
That's all you can do. You come to work and we try to be as positive as we possibly can. They're just doing such a good job. They haven't lost any compassion. They're doing everything they possibly can to take wonderful care of their patients, and I'm very proud of our staff here.
If Tiffany could ask one thing from us in addition to getting vaccinated, it would be this. If you or a loved one has access to primary care or urgent care, or a doctor or a nurse's hotline that you can safely call first before heading to the emergency room, please use that option first if you're not in immediate danger. I'm Alexis Del Cid.